Today I want to discuss about a very common and basic dental problem, that is a tooth decay. So I want to tell you that tooth decay is the main reason for almost 80% of all the dental problems that are there, and this is where it starts. So let us quickly today cover A to Z about tooth decays. What are the stages, what are the causes, what are the signs and symptoms, and what are the best treatment options available for that. So hi, I am Dr. Suhaas, Chief Dental Surgeon, Oral and Maxillofacial Surgeon, Implantologist, based out of Eledent Banjara Hills, and we have branches at Kondapur, Kukatpally, Manikonda and Banjara Hills. Right. So what is a tooth decay? You all know what is a tooth decay. You have seen some decays like this, black spots on the teeth, tooth are worn off, blackish brownish discolorations, tooth is totally vanished in certain places. And let me tell you, even if the teeth is in this condition, we can still save the teeth. We can still save this teeth. No need to remove it. I'll tell you further how. So next we'll discuss what are the various stages of tooth decay. So first of all, quickly if you see here, this is a healthy tooth. There is absolutely no decay, and still if there is early signs of soft decay, you might see a very small brownish discoloration or blackish discoloration. You can go with sealants, spit and fissure sealants and fluoride application. That is the first stage. Next is decay in enamel. So you all know that there is an enamel coating on the teeth, then there is dentine and pulp. So infection is just at the level of enamel. It is very simple. You just need to get a dental filling done and that's it. All the problem stops there. But most of us, almost 90%, everybody neglect this very basic dental filling, and then they end up in the soup. They need root canals, they need extractions, they need implants. Everything starts here only, my dear friends. Everything starts here. So get all the cavities cleared by fillings at the earliest stage possible. Then the next stage is the decay is extending from enamel into the dentine. So dentine here is the second layer of the teeth, and at this stage still it is not touching the pulp. So when it is not directly still in contact with the pulp, we can still do a filling, but there will be sensitivity because we are entering into the dentine, and your dentist will tell you if just the filling is enough or you need a cap over this. So at this stage filling is required, and we can put a cap also without a root canal. So till the third stage still root canal can be avoided. Now coming to the fourth stage, here the enamel is gone, dentine is gone, and the infection cavity has spread to the pulp. Here there is a pulpal decay, and now we have to do what is called a root canal treatment. So we have to remove the pulp, all the infected tissue, and then do a root canal and then put a cap. And finally, if you leave it at this stage also, which most people do, that is what the cracks in the tooth, the earlier I have shown you cavities, that is how this happens. And at the base of the teeth below the root there will be abscess, and now it can be saved in most cases with the help of a root canal treatment, but it can go for an extraction as well. So you have to be very careful at this stage. Now let us discuss what are the why these cavities actually happen and what is the main cause. So cavity is nothing but an infection in the tooth because of bacteria. So bacteria feed on the sugars from your food and anything that you eat, not just the sweets, but anything you eat has sugar in it. So bacteria feed on them and release acids. These acids dissolve your enamel and dentine, and that's how the blackish discoloration occurs, and that's how the cavity starts. So now next let us discuss what are all the different signs for indicating that there is a decay. So first sign is a toothache. So toothache can be a pain around the teeth or the jaws, and mostly if you feel that the teeth is fine and still there is pain, that could be a decay. Next, there could be dental sensitivity, where hot and cold things are become unbearable. That could be even due to a decay. Then bad breath. So whenever you are having a bad breath, there is a good chance that there is a dental cavities. Maybe there are multiple cavities, and the bacteria is eating upon your enamel and dentine, and that is one of the reasons for bad breath. Next, because of this bad breath and this bad environment, there is going to be an unpleasant taste as well. So the taste also changes, and that time you should be careful. If it is not due to the gum problems, there could be a cavity related issues. Multiple cavities could be there, that could be the reason. So that is what you should be careful about. And last and final, you will see different colored spots on your teeth. There can be whitish discoloration as well. There can be yellowish, brownish stains on the teeth. So those could be cavity again. So now in such cases, as I told you, when we reach into the pulpal decay, we need root canal treatment, and even in most cases where there is abscess, we need to do a root canal treatment. So let us discuss what is a root canal treatment. So you can see here the pulp is involved, and now we have to do a root canal. So what a dentist will do is, basically, I'll show you here. So here the decay is there, and a dentist will make a small hole from top, take out all the red colored blood vessel and nerve of the teeth. Dentist will take out all the red colored blood vessels and nerves of the teeth using some small instruments. He'll clean it up everything, and then he'll fill it up with a medicated dental material called gattapacha, and then he will seal it with a filling. And finally, as the tooth now is weak due to lack of any nourishment, the tooth has a good chance of fracture, so we give a crown on top of it finally. So that is root canal treatment. So I want to emphasize on a very important point here. Root canal treatment is done in all the clinics everywhere, but few cases are very tricky. You must have seen people getting painful root canal treatments. You must have seen people getting pain after few days of root canal treatment, and sometimes after few months of treatment. They have gone to the root canal, crowns have been put, but still there is pain. Why? This could be because the root canal was not 100% done with accuracy. So it is a better choice if you can use lasers and microscopes during root canal treatment. So I'll tell you more about it in another video. It is a lengthy topic, but I'll tell you briefly. So this is me doing a root canal treatment using microscope. So with that magnification, I can do precise treatment, take out all the infected tissue inside, and you can I can see what is happening with high magnification on the screen in front of you. Even you can also visualize directly what is happening. Most of the times we don't know what is happening, so that is how you use microscopes. And you go ahead with laser in RCT. So lasers, we use fine tip and go into the canal and take out all the infected tissue. So lasers and microscope treatment for 100% best results. So first thing is precision, as I told you, nothing will be left out. Next is, because of use of microscope, I don't have to dig out the teeth entirely, creating a big hole, so it is minimally invasive. Sterilization, the lasers, it will sterilize the entire soft tissue and infection inside. It has also antimicrobial properties. Next, because of this, there are improved outcomes, because there is good disinfection, and then there is very negligible chance of RCT requirement or reinfection. And finally, patient comfort. This is very important here. Patient comfort is very high when we use microscopes and lasers, because we have to reduce very minimally. We take out entire infection immediately. The next day itself, patients will feel almost zero pain. So that's what I wanted to tell you all about tooth decay. So hope you all understand the importance of tooth decay. If possible, identify it early and go visit a dentist nearby, or you can come down to any of our Eledent branches and discuss, find out if these cavities are there, get fillings done. Else it is going to go to root canal. Even if it is going to root canal, don't worry, we got you covered. So you can go ahead with lasers and microscope for the best results. Thank you.